Did you know that Botox is being used to cure medical issues? No, not just your laugh lines and wrinkles. Botulinum toxin, or Botox, as it is often referred to, can be used to treat many different types of issues. I know Botox is mostly known for being used in cosmetic treatments to improve facial features and facial appearance, but there is a lot more to Botox. Botox was created in the 1980s by Dr. Alan Scott, who was an ophthalmologist. Dr. Scott was looking for a cure for crossed eyes when he stumbled upon the fact that Botox not only helps crossed eyes, but it makes wrinkles disappear. Botox is made from a purified, mostly harmless neurotoxin that causes the disease botulism. I know that can sound scary. Botulism sounds scary. But the medication temporarily paralyzes the facial muscles that cause wrinkles and laugh lines. This treatment can last 3 to 4 months per application. So your face will have that paralyzed look for 3 to 4 months after you get your injection in that area. From then out, the product took off and it has been used by many people to treat those laugh lines and wrinkles and give their face a more refreshed look and get those features that they're looking for without going under the knife. So Botox came around and made it possible for people to do something without getting surgery and without just hoping that something would work, said Linda Wells, editor-in-chief of Allure magazine. In 1990, Dr. Scott sold his stake in Botox to the pharmaceutical company Algerin for $8 million. Today's reported sales are more than $1 billion per year. I'd have to say that was a lot. Now, while this is great for cosmetic procedures, Botox has been approved by the FDA to treat medical conditions since 2002. Some of those conditions include migraine control, severe sweating, muscle stiffness, and just recently it has been approved to treat urinary incontinence. I'd say that's pretty good, especially since there are people that do suffer from many of these things, migraines being one of those things. And of course, it actually is approved for its actual purpose, treating crossed eyes. I personally know a person who had Botox to improve her migraines, and she said it was the best thing she had ever done since first getting migraines years ago. She said it works well at preventing the migraines from even starting, and if she does get the migraine, the injection areas help dull the pain that she may be feeling, and it feels more so like a headache than a migraine, which for her makes them more manageable. I would probably agree. Having a headache is more manageable than a migraine. If you've never had one, you know that they are painful and cause all types of issues. A few other areas that are currently being researched but not yet approved by the FDA are erectile dysfunction, cold hands, depression, and abnormal heartbeat. While Botox was supposed to just treat crossed eyes, that was its main purpose and its main goal, a number of great treatments have come from this drug. The treatments span through many different aspects of medicine and have brought great relief to people suffering from these different medical issues. So the next time you hear someone talking about Botox, know that it is way more than just a wrinkle releaser. I actually have some photos that I would like to share of people who have gotten Botox, because that's really more so what I could show you, before and after photos. These photos are very interesting, and when you see the difference, it really does work. So here is a before and after of a lady who got some Botox. I'm going to scroll this right there. If you look at her face, this is the before. Her eyes look a little bit tired and a little bit more closed. But if you look at that after, she looks refreshed. She actually looks, I want to say, even happier after. So there's that one. Another one that was very good was this one. This one's probably my favorite. This lady's forehead wrinkles and laugh lines were very deep and prominent. You could see them very well. That's her before, right over here. Her after is on this side. Look at how beautiful and smooth that skin looks. It does make her look younger. So I would say that the claim that having Botox makes you look more refreshed and younger is absolutely correct, because she does. She looks great. Men are even doing Botox as well. It's called Brotox. Very interesting. This gentleman here had some done. And as you could see, this side here is the before and this is the after. And again, you can see that the forehead lines, the wrinkles, do look more clear, and less tight. So they don't look as prominent as they were. And he looks younger. He actually looks happier as well. So I would definitely say that getting Botox treatment, even for yourself, I know that it's, something that can treat depression. I know a lot of people do have issues with the way they look. So I would say looking better will definitely assist with the way you feel. Your appearance can definitely assist with depression. Here is another photo of a person who had the Botox, and you can see the laugh lines are reduced as well. This one is the before and this is the after. And you can see that, make sure, there we go. You can see that the laugh lines and the wrinkles around her mouth, eyes, forehead, you cannot see them as prominently in this photo. They're nice and almost gone. So I would say that the claim is true. So again, the next time you hear someone speaking about Botox, do know that it can change a lot of things, of course, with your features, but also with your health and make you feel better.